Good evening. I am Dr. D.P. Chakraborty, at present working as a cardiologist and consultant physician in Apollo Clinics Hospital, Kolkata. Today our discussion will be hypertension. You know, hypertension is one of the giant killers, or rather silent killers, among us. In the world wise, if we see the epidemiology, we'll find hypertension is one of the major cause of death and morbidity. And India is no exception. India has got a lot of people with hypertension. Even in our day-to-day practice, we do find a lot of cases of hypertension. And more surprisingly, it will be emerging. Young hypertension number is increasing day by day. Now, today our discussion will be what is hypertension and what are the factors that lead to hypertension and how to prevent the hypertension and its complications. You see, the hypertensions, you can divide etiology, some risk factors are there, and among the risk factors, we can divide into two, modifiable and unmodifiable. That is, cannot be modified. As for example, if you find the age, more the age, more particular systolic hypertension is more in elderly individual, because of more arterial stiffness, we get more hypertension. Modifiable risk factors, unmodifiable risk factors, age is very important, and sex. Usually, before menopause, the male are more sufferer from this hypertension, and in post-menopausal age, hypertension incidence become equal male and female. Some racial factors are there, as for example, South Asia populations, particularly including Indians, Bangladesh, Sri Lanka, their incidence of hypertension, obesities, and metabolic syndromes are higher than the Caucasians. And among the list of modifiable risk factors is very, very important: smoking, excess salt intake, particularly sodium salt intake, eating of fast food, high cholesterol food, alcohol intake, regular smoking, etc. These are the we can modify, and lack of exercise and sedentary habits. So these are a few risk factors we are facing in our day-to-day life during management of hypertension. Then come, of course, what is the normal blood pressure and what is the definition of hypertension. The normal blood pressure, is 120/80. Everybody knows, usually in adults, more than 18 years of age. Blood pressure is 120/80 usually. And you do often define systemic hypertension as more than 140/90. The standard definition is 140/90. The standard definition of hypertension. If it persists, it is known as hypertension. And why we are interested to know the hypertension? Because of its complications. The hypertension is very much related to cardiovascular events and cerebrovascular events. That means the heart attack and cerebral attack. It has got more relations with the stroke problems, both cardiac as well as neural. Then come kidney failure, eye damaging of the eyes, and whatnot. So the complications is devastating. So we have to manage hypertension very sincerely and with a good hand. Before management of hypertension, we'll give emphasis on the modify the risk factors. So first of all, you modify the risk factors. Then you treat properly hypertension with the proper drugs. There are so many good drugs are available in our armamentarium. Today the science far advanced. So controlling of hypertension is now very easy. So at first, the risk factors that we have discussed previously, that should be modified. So number one, we do the regular exercises, very important exercise. In my practice, usually advise to our patients the 5 important points. Number one, regular exercise. Number 2, regular exercise. Number 3, regular exercise. Number 4 and number 5, regular exercise. So regular exercise is very, very important at some age. So after some age, is very, very important, essentially important to maintain the blood sugar as well as blood pressure. Then of course the healthy diet is important. Hypertension diet are there, but your DASH diet, we know as DASH diet. The diet will have it system to hypertension. Then quit smoking, stress management and adherence to that is very, very important. Adherence to medicine. To take the medicine. Some people say, oh, Dr. Oshud roz khache pressure kare komche na. Jodi amra thale dekhi, search kore dekhbo je 4 oshud likhle hoyto 2 oshud khachen, 2 oshud khachen na. This should not be habit. You should take adherence to medicine is very, very important. Stress management. And of course, the most important, regular blood transfusion monitoring. So, রোজ ব্লাড প্রেশারটা দেখাটা ঠিক নয়। ব্লাড প্রেশার যখন কন্ট্রোল থাকবে না তখন সপ্তাহে একদিন দেখাই ভালো। কন্ট্রোল হয়ে গেলে মাসে একবার সাফিসিয়েন্ট। অনেকে সকালে দুপুরে বিকেলে ডিজিটাল মেশিনে দেখছেন কখন 200/100, কখন 160/100, কখন 100/10, আবার চেম্বারে 20 বার টেলিফোন। So this is actually the fallacy of the digital BP machine. You should go to your nearest doctors. You check your blood pressure properly with the proper machine in a proper time. Then last is very, very important. You should make the regular yoga is very important if it is possible, if the time permits. Yoga is very important and meditations is very also helps to control hypertension. And of course, you quit smoking. Smoking, there's no smoking already test. And most important, last, I'll take adherence to medicine again. You take medicine properly. You take good advice to your doctor. You quit the adverse risk factors that we have described. Thank you very much for listening our notes. Thank you again very much for your kind participation. Namaskar.